assistance medical care was eliminated back in May of 2009, there were actually people in this building who thought, no one will notice. Who's ever heard of general assistance medical care? It's just another one of those little government programs, right? And they thought, nobody will notice. Well, okay. Somebody might notice, but you know what? They're not going to care. They're not on the program themselves. It's not their problem. They might know about it, but they're not going to care. Okay, well maybe they'll care, but they're sure not going to do anything about it, right? Today was supposed to be the day where we all wrote, angry emails. It was supposed to be the day of a trickle of emails coming to the Capitol, but it's not that day, is it?
We know what it means to have a safety net that will catch us when we fall. And we want to make certain that that safety net remains well knit together to protect those who at times in their lives when they desperately need health care would otherwise, without GAMC, find it unacceptable.
The last 9 months have been a devastating impact as we've looked at the impact of GAMC. We serve 240 patients every week. We serve $23 million a year of care. Our mission, and it always will be, is to serve everyone regardless of their ability to pay. A $23 million hit has huge impact. It will impact consumers and all of us who have to pay for health care because it will be transferred somewhere else, and it will affect services that impact all the citizens of Minnesota. What we need, both Republicans and Democrats, all of our lawmakers who are putting in a lot of time and making very good effort, we want them to know that we're there with them. We want them to know that there is a solution. We've seen some solutions, and we want them to know they've got our full support. The challenge is, get it done.
We must demand of our elected officials, those officials who right now have assurance of health care, those officials whose next meal is guaranteed, and those who have a shelter, I believe, with a bed. We must insist that they stand with those who are less fortunate. They must do the right thing.
At this time, we invite you to a moment of silence for these people who are affected by these cuts. These are the people for whom this issue is life and death. For these people, it isn't party line politics. It's about surviving the harshness of the streets, the shelters, and the elements.